Good morning and good afternoon, everyone. My name is Stephanie Nichols. I'm a senior housing specialist with the Housing Assistance Council. Welcome to the Nuts and Bolts session. This session has always had a special place in my heart. I was just out of college when I had the privilege to assist Art Collings with Nuts and Bolts 2 decades ago. That session, just like today, is a chance for you, practitioners in the field, to hear firsthand from decision makers at HUD and USDA Rural Development. It's my privilege to introduce today's speakers. Cathy Glover, Deputy Administrator, Single Family Housing, USDA Rural Development. Cathy started her career in housing and farm-related programs in 1988 with the Farmers Home Administration in Illinois, moving to Washington, D.C. in 2004. She served in various roles at headquarters, including Director of Single Family Housing Direct Loan Division, Assistant Deputy Administrator, and Executive Director, Single Family Guaranteed Loan Program. Unfortunately, our next speaker, Nancy Ann Bodell, was unable to join us today, but I have the pleasure to introduce Jen Larson. Jen is the Director of Multifamily Asset Management Division at USDA Rural Development's Rural Housing Service. She has nearly 20 years of private and public sector experience in the affordable housing field in roles spanning the stakeholder spectrum from nonprofit owner, manager, developer to senior leadership positions at HUD and now USDA. Chad Parker, Deputy Administrator, Community Facilities, USDA Rural Development. Chad started working at USDA in 1991 with the Rural Electrification Administration and presently serves as the Deputy Administrator, Community Facilities Program. During his USDA tenure, Chad served as the Assistant Administrator, Telecommunication Programs, as well as having previously administered cooperative programs, business programs, single-family housing programs, and community facilities programs. Todd Richardson, General Deputy Assistant Secretary, U.S. Department of Housing and Urban Development. Todd leads HUD's research arm of approximately 145 staff that manage national surveys, conduct and manage research and program evaluations, and develop program parameter data to support HUD's major programs. He has developed several funding allocation formulas for HUD's programs, including the Indian Housing Block Grant Formula, the Neighborhood Stabilization Program Formula, and formulas to allocate post-disaster supplemental appropriations. And our final speaker, Stephen Washington, Director of the Office of Policy Development and Coordination in HUD's Office of Community Planning and Development. Steve manages various programs, including Section 4 and the Rural Capacity Building Program. He also is responsible for the resolution, closing of outstanding CPD Office of Inspector General audits and the closing of expired grants for programs such as CDBG, Home, and SNAP. Other duties include the oversight of Economic Development Initiative and the Neighborhood Initiative. Welcome, everybody. So we have 2 questions that each presenter will respond to one at a time. And then as time permits, we'll open up a few questions from the chat. And then finally, we're going to come back and provide a few minutes for each presenter to add in some final thoughts. So let's jump into the first question. 2020 has been an incredibly difficult year, and it's especially difficult for many rural communities, for minority populations and people living in poverty. As it relates to the pandemic and subsequent economic downturn, can you please speak to the strategies that your agencies have implemented to position programs and services to help families hardest hit by the pandemic and the grantees, communities, and nonprofits that serve them? And then the second part of that question, most of our audience today is representing rural nonprofit housing organizations. What would you recommend these organizations do in terms of repositioning their priorities or pivoting services and activities to be responsive to the needs of their community? I think we're going to turn it over to Steve Washington first.
Well, thank you, Stephanie. And good morning to some and afternoon, I think, to most, but appreciate the time. Well, folks, it's been some type of 2020, hasn't it? And the one thing I want to start off with is saying that we will get through this. So with that said, I want to talk a little bit about what we at HUD, in my office in particular, did to kind of change the narrative and deal with our environment, our current environment, as we deal with our clients and customers. So, the first thing we had to do, frankly, is to put a pause on things. We had to stop and literally, in my office, regroup, because just like you as our clients, this is unprecedented for us. So the first thing we did actually was stop. stop. It's not business as usual. And when we stopped, then we sat down and we had to say, okay, it's time to pivot to ensure that we meet the needs of our customers. Remember, you are our customers. Just like a bank has customers, we as federal agencies, you're our customers. I mean, there's some differences. We have to make sure you follow the rules and regulations, but we had to stop and pivot. This was really driven by my team, and I want to give them credit. I'm not going to name them one by one, but the team, our staff, the staff that works with me in the Office of Policy Development, really were the ones that said, stop, we got to stop, Steve, revisit. Our clients, our grantees are telling us we need to revisit how we do business. So I want to thank them again. But the first thing for us was determining and realizing, unfortunately, we have a new norm that we're operating in. And remember, folks, we go way back to March when this all first started. And I, for one, and I've heard from others, never expected this to be prolonged as long as it's been. And so that was the first thing for us, to kind of revisit and figure out how to be more, and I'm going to use these terms, nimble and flexible. And one thing that helped us in this regard, there's been a lot of talk about not enough guidance on how we deal with COVID nationally, but the Office of Management and Budget, OMB as we call them, actually put out some guidance to help us. And that the Office of Management and Budget works federal agency wide. So they provide guidance in March. And I do want to reference that particular executive order. It's Executive Order M2011. M as in Mary 2011. And you should reference that and look at that, because there are flexibilities that you are awarded as a result of that you need to take advantage of. But we did that. And from there, we were able to be a little more creative and proactive. So really what happened from there is that we knew that one of the things that was key was for us to communicate with you better. Because I don't have a crystal ball, the staff doesn't have a crystal ball. We needed to hear from you what was going on. One of the things, and I'll mention this right up front, that we were afforded the flexibility on was changing the use of funds. We had numerous years of grants out, and basically what folks use our funds for is to go out and train, but they have to get there. So they have to go to a rural community. So travel was a big part of the budget. Well, we were nimble enough that, number one, OMB, the Office of Management and Budget, allowed us to change the budget categories from travel to other categories. And here's the key thing. In rural communities, and we work with urban communities too, but in rural communities, a couple things go on. You gotta really travel to get there. And normally you have limited resources. A city like Charlotte, North Carolina is different than a very small community in North Carolina where they don't have resources. So you may actually be the only thing in town, and that's a key thing. So what we started doing immediately is receiving requests that said, okay, we don't need to travel, but I have someone over here whose office is going to close, or who had 2 employees and now they only have 1, or much less had 1 employee and don't have any now. So we changed that so that we could be more flexible. It wasn't just for travel, now it could be for salaries, now it could be for reopening an office if needed. So we needed to get a firm foundation for those that were not able to operate because the pandemic hit them hard. No resource office they could go to, no funding, not enough funding for salaries. Because as my mother used to always tell me, and I really recognize this, you can't pour out of an empty cup. So you have to really provide folks with some ability to do what they were going to do. Then what we did was regroup and said, we need to ask what is needed. So what we did shortly after we received the OMB guidance is I said, you know, we can't have our clients all over the place. We have to help them get through this. So I called a meeting with all of them and sat down and told them and shared with them a bit of what the guidance said. But more importantly, we opened up and said, what is it you need? As I said, I can't guess. I don't need to. You have boots on the ground. You can tell us what you need. What do you need? That was the question. And I'm not always going to be able to say, yes, we can give it to you. But if you don't ask, I won't know, and I certainly can't help you. But if you ask, I'm going to do everything in my power to make sure you get what you need. Again, you are in areas that are probably in more need because you're in a rural community and don't have as many and have limited resources. So I guess my takeaway is that I must hear from you to know about what you need to do. If you need to do this in one case, you need to do this in another case. And the other thing that I need to point out is that, you know, there are different needs in every one of our entities that we work with. Let me quickly just give you a few examples and then try to touch upon the second question. I mentioned one of the changes we did. We quickly, in those cases where we could, move funds from travel to salaries, to opening up an office, to providing funds for that, to providing assistance with technology so that folks can be trained or accessed when they're dealing with their clients. Because remember, we fund organizations that go out and build capacity with other smaller organizations. The next thing we did was determine what COVID-related reopening things that might be needed. As I said, you may be the only entity in town and you need to be open. You may be the only entity in the county. You need to be open. Another thing that happened kind of as we were working on it is that we were behind in preparing our next funding request. We're always a year behind. We were working on 2019 during 2020, but as fate would have it, Congress approved funding for 2020 during 2020 for the first time in a long time. So we coupled those and had a bigger pool of funds are available, and we tried to move that through quickly. And frankly, we just finished with the competition for a joint 2019-2020 funding cycle. So we moved that along quickly. The other thing, and I have just two more before I go to the second part of the question. The other thing that we did, we encouraged partnerships. The USDA, who was on here with us, even they were working with one of our other partners, or our other entities. They have, for example, a housing preservation grant program that folks were able to access. And I'm sure they can speak to that. I'm not trying to steal their thunder. But other two entities that I would suggest, banks, they still have their Community Reinvestment Act requirements. Those didn't go away. They may have an office that closed. You may need an office space that you can use. Approach them about things of that nature. They may have funding that's available. You never know. It may be grant funding. You never know. Reach out to them. Other not-for-profit entities as well. We actually work with 3 other entities that work in urban communities that are required to do work in rural communities. I'm going to tell you their names real quick. Enterprise Community Partners, Habitat for Humanity International, and the Local Initiative Support Corporation. Now, I'm not saying for sure that they'll be able to partner with you, but reach out to them. Reach out to them, you never know. The final thing I'm going to say on the first question is, I encourage you to not just communicate with us, but to communicate with all your partners more than ever before. These are different times. Your needs are different. You need to express them. You need to request them, things that you need. Make us say, yes, I will do everything I can and have, but make us say yes, bring it to us so that we can have the ability to help you. So that's kind of how we've been operating now. Here are some things I would suggest for the future. I'm going to start where I ended. You need to communicate with all of your partners. Let them know what your needs are. We have some flexibility that's in writing, but there are probably flexibilities beyond that. The second thing I would say, early on ask. If you're not sure if it's something you might want to do, let us know, because maybe somebody else has already done it and it worked. Or maybe it didn't work and this is a modification to it. Flexible and nimble, remember that? This is very important. Document what you're doing during this period from March to now, because although I pray that we never go through this again, there's no certainty that we won't. You need to document it so that the next person coming around, if we have this, has at least a game plan to start with. It may be different a bit, but document your process. Get some standard operating procedures in place for how you're operating now in the midst of this pandemic. The last couple of things I'll say is keep and enhance those partnerships that you develop during this time. They are important. I mentioned banks, I mentioned other not-for-profit entities. Actually, some of the same not-for-profit entities that are working in rural communities, partner up with them. Maybe you both can't operate independently anymore, but you can partner. So the last thing I'm going to say before I turn it back over to you, Stephanie, is that we need to realize that this is unique, because I normally say to folks, you know, it's either a sprint or a marathon. This is both. We are in a sprint because there are needs right now. My vision of that is, if you look at what we've seen on TV with cars lined up with people who normally, or some are working, or who used to be working, needing food, especially over Thanksgiving. That's different than we've seen before. So it's a sprint in that we got to meet these needs immediately. But it's also a marathon, because even now, folks are saying this vaccine is not going to be available for everyone until mid next year. We have to position ourselves to be able to deal with this long enough to get to the end of this. As I said, I pray that we never have to experience this again. But remember, we got to crawl before we walk. We got to walk before we run. We got to get to the end, and we will. My final comment is that we at HUD, and Todd, I'm going to let you speak for yourself, but I'm sure the same applies, are here to help you. Just reach out to us as you need. And I appreciate your time. Thank you, Housing Assistance Council, for bringing us on board to have this conversation. And I'll be ready to answer any questions if we have time at the end. Thank you, Stephanie.
Steve, so many pieces of great advice. I can see lots of things being quoted. Todd, would you like to take over next and respond to the initial question?
Absolutely. I'm going to take a little different direction here. So being the research and data part of HUD, the big thing that we have pivoted on here is that we realized we need to get data much faster than we normally do to understand what is happening in real time. In particular, we're interested in understanding how unemployment, the CARES Act, expenditures, home ownership forbearance policies, eviction policies, how all those are changing monthly and how that's impacting housing payment, foreclosures, and evictions. So for those of you who like data and like a data heavy presentation, I'm going to give you a lot of numbers here, and you might want to grab a pencil. For those of you who don't like data, you might want to go grab some lunch. But here's the data thing. So your HAC team just gave a fabulous presentation, great researchers at HAC, on sort of what a lot of data issues in rural areas. What I'm going to offer up here is sort of like hot off the presses data that's useful, I think, right now with the monthly data. So I'm going to start with unemployment numbers. Now, we all hear this on the news. I don't know about you, but I find the way the unemployment is being presented on the news to be very confusing. That's because a lot of different unemployment numbers are flying around. So I'm going to offer a little bit of sort of like, tell you how they're a little bit different. So the official unemployment numbers are based on surveys. So there's a monthly survey that comes out with the unemployment numbers. In fact, the November numbers are going to come out tomorrow from the survey. Now, this is a nice measuring stick, and it peaked at, unemployment peaked under this measuring stick in April at 14.4%. 7%. It's been declining ever since. In October, it was 6.9%. So that represents 11.1 million unemployed individuals. Another measure, which we will hear in the news today, is around unemployment claims. Unemployment claims and receipt of unemployment are very different kind of statistic, and they're different because this is administrative data from states. Now, as you know, the basic state unemployment benefit is 26 weeks, and many states extend that to 32 weeks. The CARES Act allows for that to go out to 39 weeks. Those CARES Act funding expire at the end of December. In addition, the CARES Act pays for unemployment that we don't normally pay for gig workers and such. So if you look at the unemployment, who's receiving unemployment benefits, you can see that about 5.6 million individuals are receiving the regular state benefits, but another 13 million, so that's less than the national sort of estimate of 11 million, but another 13 million are receiving unemployment benefits through some form of CARES Act funding. So all told, we have 20 million individuals receiving unemployment benefits at this time. So, and the reason why I think that's important from a housing perspective is that is a major source of money going right now that people are using to pay their unemployment benefits. Congress is currently debating whether or not to do some extensions on those unemployment benefits. But that's going to be very important because they have been helping people pay rent. So now I'm going to shift gear to the data we have that's current data on people's ability to pay their housing payments. So the Census Bureau initiated a survey called the Pulse Survey. This is a really cool survey. It's a survey that collects data over a two-week period, and within 3 days of that data being collected, they're making that available to us to be able to see what the results are. So this massive survey, and it has about 100,000 respondents each 2-week period. So it's a big survey. And so it gives us a lot of great data, and it's real-time data on what's happening. So when we look at those data in the housing space, we can look at and see that there are about 4.7 million renters that are not at all confident about making their rent payment. And that was dated from August, September, and October. It was about 4.7 million renters saying that they weren't confident about making their rent payment. For November, the last 2 weeks of November, the most recent data we have on this, so just available from the last 2-week period, that jumped to 5.4 million. So we're seeing renters getting more nervous about being able to make their rent payment. And that's something, they're seeing the end to these moratoriums, and we're seeing people falling off of unemployment benefits. So that's seeing this spike here. This is similar about renters who think it very likely they're going to be evicted. That had been at about 1 million in August, September, and October of renters saying they think that it's very likely they'll be evicted in the next 2 months. That jumped to 1.23 million in the last month. Homeowners, however, are a very different story. We have these forbearance policies in place. And in fact, on the homeowner side, we saw a decline in homeowners thinking it very likely they'll be foreclosed upon, falling from a relatively small number of 350,000 to 220,000. So on the homeowner space, the policies are still holding. It is in the renter space where we see the sort of this growing crisis. Now, these data these Pulse survey data don't break down by rural, urban. We can, however, split it out by the 15 largest metro areas versus the rest of the country. So when we look at that, the national rate of renters saying that they're behind on the rent is 16%. Of those outside of the 15 metropolitan areas, it's about 15.2%. So that seems like it might be a little better, but not a lot better in areas that are the sort of less metropolitan. But the flip side of that is this survey, we break it out single family versus multifamily, and we know that single family rentals are more prevalent in rural areas. And the Pulse survey shows that for folks living in single family properties, that they're reporting 18% of them are reporting they're behind on their payments versus 13% for multifamily properties. So this issue of missing rent payment is more severe in the single family market than the multifamily market. I mention that because the other data we have that's really cool is administrative data from the tech companies that serve the multifamily housing market. These tech companies can tell us about payment of tenants because there's a relatively few tech companies serving most of the multifamily market. And we can break it down by market rate, by USDA, by HUD. So from those data, we can see that in general, for the HUD public housing and project-based Section 8 tenants, that they're about 85% of them are making their payment within the month. 88% of USDA housed tenants, 90% of tax credit tenants, and 95% of market rate tenants as of the end of October. We should get November numbers next week for these data points. So I'm expecting those November numbers to be similar to the Pulse survey, where we're going to see them get a bit worse. Now we can see that for August, September, and October, that the project-based Section 8 and the USDA numbers are about the same as we saw last year. But for the tax credit and market rate, they'd begun to show some signs of folks being lower rates of making payments. So folks without subsidy are beginning to show some struggling. And I'm expecting that to continue into November. So we'll get those data next week. So that's my comment on the first point of this pivoting on the data and research to know what's happening in real time. Now, switching gears to, so what? Well, so what of this is that emergency rental assistance program. So this is the second part of the question here. It's emergency rental assistance programs is something that we don't usually do with our CDBG or ESG money, but it's something that people are starting to do with the CDBG and ESG money. And that's going to be even more important now, depending on what Congress does. But there are people falling through the cracks now of the existing systems in emergency rental systems, and to the extent you're setting up emergency rental assistance programs, it's really important they start getting up and running now. I can see in the data that very little of the CDBG and ESG CARES Act funding has been expended to date. So there's money there, and that money can be used for emergency rental assistance. I know it's very hard because both those programs are rarely used for that, so everybody has to ramp up. But if you're ramping up, I just want to encourage you to keep working at it, because the time is now that we really need to be working at that. So that's it for me.
Much, Todd. We're going to switch gears and now move over to USDA, and I think we're going to kick that off with Cathy Glover.
Okay. All right. Yeah. Thank you. Thank you, Stephanie. And thank you, HAC, for hosting this event today and for having us all on. As I think most of you know, USDA administered two major home loan purchase programs, the single family direct loan program and the single family guarantee loan program, and that we also administer the rehabilitation program, 504 loan and grant programs. Right before the pandemic hit, we had already realigned our single family guarantee loan program. All loan approval, loss mitigation, and compliance functions were realigned under our national office structures. The functions are realigned, but the staff remained in the state. While we always think of single family as a moderate loan program, I like to share that of the nearly 138,000 loans we guaranteed last fiscal year, approximately 25% of those loans were provided to very low and low income families, and that's families with median household income under 80%. Because of the delivery structure and automation systems that we have in place, we were able to administer the single family guarantee program with zero interruption to our customers. This included managing an entirely new virtual staff and moving them from an RD state office or a field office to a remote duty station. The change in our direct programs, especially the 504 loan and grant program, were not as easy to overcome during the pandemic, but we managed with some temporary programmatic changes. In our 502 direct program, we were successful with some electronic processes, and I admit they were long overdue. We were able to expand abilities to accept electronic signatures from our applicants and from our staff as well, so that we can communicate. We also collected email addresses from some of our applicants when available, and this gave us a new way to communicate with some of our rural customers. A big win, we were finally able to electronically accept the credit report fee, eliminating the need for the customers to mail in checks and money orders, because remember, a lot of the offices were closed and we had no way to receive that. Up until the electronic credit report fee breakthrough, we got a little creative and we allowed our packagers and our self-help group to provide the credit reports to us. So we found other means to get the credit reports so that we can continue to process those applications. We also made some exceptions for our self-help groups, and then we leaned on our partners as much as we could. We continue to monitor the structure and administration of our program, and the pandemic just showed us that we can deliver, but kind of to Steve's point earlier, we can't do it alone. We need help of our partners. To the second part of the question about priorities, one thing that we did was we stepped back, and I think Steve might have mentioned this as well. We stepped back. We didn't release anything. We just kind of took a look. And what we did immediately was we connected with our partners at HUD and VA, since HUD is the largest insurer of government loans, and followed by VA, and USDA is the smaller of the three agencies. So we coordinated with them with our guaranteed program, but we also took that information, that coordination from single family guarantee, to make sure it aligned for our single family direct program. The last thing that anyone wanted was for HUD and VA to be doing something and USDA to be doing something totally different. We're all in this government lending game. So we just wanted to make sure that we were aligned and what we were doing made sense for the customers. And same thing with our direct program. We didn't want to do anything on our guaranteed side that would hurt the direct side or that would be so counter to what we were doing on the other side. So we tried to maintain some consistency amongst housing in the entire government housing lending structure. So really quickly, in a nutshell, that's what we did in single family guarantee. So our advice would be, to stay connected with our partners, and that seemed to work well for us. So I'm going to turn it over now to my colleague in multifamily housing, Jen Larson, who's acting for Nancy Ann today. Jen?
Thanks, Cathy. So great to be here today. We in multifamily were in planning stages for our own realignment as the pandemic was just starting. And so we ended up going ahead with it, and just wanted to share a little bit with you about our new organizational structure. We implemented in July with the first wave, and then the second wave in October. So we're fully implemented now in our future state. Previously, multifamily housing programs were administered by 47 different state offices, which gave us some challenges. State offices differed in structure, policy interpretations, and turnaround times. Staff often had multiple roles and just was not conducive to consistent program delivery. So we've now consolidated under a national office structure where we have the multifamily group under the Deputy Administrator for Multifamily, Nancy Ann Bodell. We have three divisions: the Field Operations Division, which handles the direct servicing of all of our multifamily properties out in the field. And these staff did remain in the field. They remained in the different offices, but they're now reporting under a centralized structure, broken up into 4 different regions. So we have a regional director in the Northeast, in the Midwest, in the South, and in the West regions. And then under those folks are teams of servicing staff that are performing the day-to-day servicing activities, formally divided up under each state. Then we also have a preservation and direct loan, or preservation and production division. They are responsible for all of our production as well as preservation activities. They are reorganized by function. So there's a processing and report review branch, an underwriting branch, and a closing branch. And then lastly, a program support branch there that's working on policy and updates to procedures. Lastly, we have the Asset Management Division, which is what I'm in charge of. We have servicing support branches there to support our field staff with anything that they might need. We also have a new risk branch that is working on implementation of a risk assessment system. And we have a policy branch there as well to deal with policy and guidance and training that needs to happen. So integration benefits to our realignment we're enabling our 4-pillar model, continuing to align our work with industry standards to allow for increased consistency and specialization, improving the way that we're able to serve our customers. We're also able to streamline our business processes, providing opportunities for a refresh and allowing programs to operate more effectively. We're also investing in people, elevating our employee experience with tools and resources to support their ongoing development and career progression, and allowing staff to specialize as well as managing workload to help keep things more uniform across the country. Lastly, we're continuing to manage important local relationships through lenders, property managers, and tenants throughout the life cycle of the asset, and focus on marketing and outreach is still in the state offices. So those folks are important partners in making sure that we're raising awareness of our programs and availability of any funding that we have. So in terms of what we have done under the COVID, with regard to COVID under the CARES Act, we did also have 90-day deferrals allowed under the CARES Act. We processed over 4,000 of those. They're mostly terminated at this point, but they were helpful for those properties that were able to request them. We also encouraged and tracked interim certification. So for tenants who lost income, if the unit had rental assistance, they were able to do a recertification and lower that rent so that the rent remained affordable for the tenant and they were able to maintain their stable housing. We did track the number of interim certifications as well as the impact on our rental assistance fund to make sure that funding was able to remain steady, and we were pleased we were able to do that. We also issued several different FAQs to our owners and agents through GovDelivery so that we could deliver information on questions we were being asked, many regarding, alternate uses of vacant units or waivers that were possibly needed, or a big one was electronic signatures, or phone certifications if tenants couldn't come to the office to do interim certification, doing those certifications by email or by phone. And just really encouraging as much flexibility as possible to still maintain compliance with our program requirements, but work within this new space that we're all living in. We just have so much gratitude to the owners and agents out there who have been able to maintain the programs and keep things going, as well as our staff that have maintained a lot of flexibility through this time. As far as our goals for 2021 going forward, we have a significant goal to implement our risk assessment system where we're looking at property risk in a lot of different areas. And those include, the financial health of the property, the physical health of the property, the health of the communities where they're located, and really using all of that information, bringing that all together to figure out which properties are presenting the biggest risk to our portfolio, and then identifying trends and common themes like that we're seeing at the portfolio as a whole. And we think, it's very timely that we're doing this right now, given that our portfolio is facing stress like never before with the pandemic. We're able to really monitor how that's affecting the properties, both individually and then for our portfolio as a whole. And then for a secondary goal, another goal is to develop preservation goals based on this risk assessment that we've completed at the properties, so that we know we have a lot of properties out there that are aging, that need rehab, and that need to locate sources of capital funds to recapitalize and maintain quality housing over the long term. And so we're going to work through what we know about the portfolio. Given the risk assessment that we're doing, we're going to have a lot more information on the portfolio, and then put together a clear preservation strategy that coincides with the funding that we have available. We are going to continue to use NPR funds to clear out our existing pipeline. And with that, I can turn over to Chad Parker for community facilities.
let me interject super quick if you don't mind. Everybody in the audience, if you have any questions, please remember to submit them in the chat in YouTube or tweet them, and we have communication staff that are passing them along to me. Sorry to interrupt, Chad. Go ahead.
No problem at all. Thank you, Jen. Thank you, Stephanie. And thanks to the Housing Assistance Council for allowing me to participate in today's discussion. Good afternoon, everyone. As many of you know, the Community Facility Program partners with rural communities by financing construction, expansion, improvements to essential community infrastructure for things like healthcare, education, public safety, and public services. Flexible nature of the CF program allows us to finance about 100 different types of facilities in response to needs of the communities. The things that CF put in place for the COVID-19 pandemic was that we first moved quickly, along with the rest of USDA, to comply with the guidelines on social distancing to prevent the spread of the COVID-19 virus. We did things like halting all non-essential travel. We halted all in-person meetings. We also postponed, we have a whole rural community infrastructure roundtables across the country. So we postponed those meetings, started to hold those virtually. My staff also quickly pivoted to implement strategies to conduct their work remotely. We modified staff instructions and operating procedures that allowed us to do things like outreach, site inspections, project appraisals, and hold public meetings virtually and through other sources of technology. That way we limited exposure to both our staff as well as the people living in the rural communities. The community's facilities also put in additional authorities for our borrowers. We worked with OMB and the Office of the USDA Department to put in some loan deferral options that we previously had legal authority, statutory authority to put in place, but had never been implemented in regulation. So we put some of those authorities in place, allowing us to do loan deferrals for a period of time. Over the pandemic, we've put 125 of our community facilities direct loans on deferrals agreements. That's about 11% of our CF direct loan portfolio. And we also put 30 guaranteed loan borrowers into the deferral status, about a little bit over 8% of our CF guaranteed loan portfolio. As the question mentioned, there are also other instances, unexpected occurrences. We're continuing to deal with natural disasters. We are especially working closely with communities that have been impacted by Hurricane Michael and Florence, along with wildfires, tornadoes, and floods that occurred over 2018, 2019, and 2020. It's not really the community facilities role to kind of be a first responder. Instead, I see the community facilities role as like a steady partner in recovery and rebuilding efforts, helping communities to get that affordable financing to repair and rebuild the essential community facilities that were impacted by the disasters. So we received under the Disaster Relief Act about $150 million for grants to fund essential community facilities in natural disaster impacted areas. So over FY 2020, we obligated $56 million of those grants and provided about $3.4 million for additional technical assistance to areas affected by natural disasters. We're working with those communities right now to plan for and fund projects throughout FY 2021 to utilize the remainder of those funds. Probably the third crisis that community facilities has mostly worked with has been the opioid crisis. There are rural towns and communities that have just been extremely hard hit by the struggle with prescription opioids and substance use disorders. Especially in rural areas, access to prevention, treatment, and recovery opportunities, it was limited before COVID-19, and after COVID-19, it has especially been a challenge. The Center for Disease Control estimates that about $78.5 billion a year are the cost of the opioid misuse. That includes the cost of healthcare, lost productivity, and the addiction treatment. So what our RHS Community Facilities has done is we put a priority in for our whole suite of programs for projects that support opioid prevention, treatment, and recovery in rural America. We've been fairly successful at it. Over the last year, over FY 2020, we funded 42 CF loans and grants to organizations that were focused on that. for a total of just over $8 million. So CF has kind of enacted all of these efforts for the COVID-19 pandemic, for the natural disasters and the opioids, and it's given us a lot of additional tools in the toolbox. So I think that will allow us, we have those tools now available to us, and will allow us to react to future natural disasters and epidemics, hopefully nothing like what we've seen in FY 2020. But that's kind of the tools that are available to CF, and I think we've done a good job in implementing those to help our rural communities. As for the second question, I think it focused on areas of priority. I think the best way I can answer that question is to highlight a couple of key sectors here for our stakeholders and partners, so that as they look to collaborate with community programs over the next year, they'll understand what our focus is kind of in supporting rural communities. The largest sectors under the CF program are education and healthcare. And those areas were already in financial crisis prior to the COVID-19 pandemic. Especially for small private colleges, they've been under tremendous financial pressure. A number of them have ceased operations. All of them have seen expenses rise and overall enrollment decline. As the landscape on this sector, looking out over the near future, it's not promising at the moment. There are shifting demographics, there's rising tuition, shrinking endowments, and there's weakening support from state governments. If you look across our portfolio, we've got about 30% of the CF portfolio invested in the education and cultural sector, with a large portion of that in rural higher education. So we're looking to collaborate with partners to figure out ways to assist those organizations that are already our borrowers and those that are struggling that aren't borrowers of the CF program. For rural hospitals, they're also were in financial distress prior to the global pandemic. Certainly HHS and some of the CARES Act programs allowed some additional immediate financing to help them, but they're still struggling. The National Rural Health Association, which is a long-term partner of the CF program, reports that right now a total of 130 hospitals have closed since 2010 in rural areas. The rural economies are really reliant on these. They provide just very essential services. The National Rural Health Association, looking at the ones that are open and operating right now, they project that 453 rural hospitals are at risk at this moment, and that 216 of them are at very high risk of closure. About 48% of the CF portfolio is invested in the healthcare sector, and a large portion of that is in rural hospitals. So we're going to continue to look and work with our stakeholders and our partners to try and make sure that there's financing available to help these communities and help these types of facilities for the critical infrastructure that they provide. Probably the remaining sector that's most important, that we see as the most important priority, is rural child care facilities. Access to quality child care does a lot of things in rural communities. It helps early education and enrichment for rural children. It removes barriers for parents, especially mothers who are interested in entering the workforce. It creates jobs. All those are things that are going to be needed as we rebuild from this pandemic. So we've got, I think, a continuing focus working with HHS and their Head Start facilities and other child care facilities across the country. So that's kind of the main facility that we're focused on. Right now, we're also focused on making sure that there's capacity development in rural communities. The CF program has a number of smaller initiatives: the Rural Community Development Initiative Program, the Technical Assistance Training Grant Program, and some of our online resource guides that provide additional resources to help build capacity in rural communities. And also my staff and the staff of the community facilities, people working the community facilities program out in our field offices, our area offices, and state offices. We are always available to engage. We look to our partners to reach out. We're willing to make presentations, talk about our programs and our resources, and to assist those communities by gaining knowledge about the opportunities that are available through USDA. So we look forward to working with our stakeholders and invite you to reach out. Always feel free to reach out to me. I'll put you in contact with the right people on our CF side. Thank you, Stephanie.
Okay, so questions, keep them coming in. I've got a couple so far, and I have one myself if we don't have enough. I think this question is for Jen. Do you know what percentage of the rental assistance recipients receive the interim recertifications? Do you have any?
Yeah, it wasn't a high percentage. We actually have about 65-70% of our tenants that are elderly or disabled, and so those people were, I think, generally on fixed income that didn't see an impact of COVID. But we did have enough of a percentage that it was measurable, and we were just monitoring that closely to make sure that we weren't going to have to have an impact on the rental assistance fund. But it was not large enough to have a significant impact on the rental assistance fund.
Okay, thank you. This next question I'm not 100% following, but I'm going to ask it, and I kind of think I have my own response. Is it possible to get a list of the federal rural housing programs, the support offered on a one sheet? If one already exists, then they would look like a link. On the HUD side, I don't think it's a one sheeter, but the HUD Exchange is a really great resource. The list of all the programs that are out there. The HAC's website is a good resource for the programs that are out there. Looks like Steve maybe wants to.
Well, I don't think there's one source for all programs, unfortunately. And Todd, you can weigh in on this if I'm missing something. But I talked a little bit about the CARES Act. So go ahead, Todd. I'm gonna. Well,
actually, there is a publication called Programs of HUD that has all of our programs, and it's a book that's on our website. You can pick it up. It's Programs of HUD. That provides the summary of all the programs. It's not offering what's happening right now. So I think HUDexchange.info, as Stephanie noted, is the place to go for most the best information that's current on how our programs are running.
Yeah, thanks for that, Todd. Yeah, and I was trying to think if there's any place that has information that might be relevant, even more relevant right now, that specifies all COVID type assistance that's available. And I don't think there's one pure location for that, Todd. I don't think there is.
The HUD Exchange. Sorry.
Oh, go ahead. Go ahead, Stephanie.
I was just going to say the HUD Exchange does have a section set aside specifically for COVID, but it's more training and information and I'm not sure if I've seen anything from USDA just specific to on the coronavirus stuff. But I'm sorry, Todd, you were gonna.
The HUD.gov page has a single place to go to get the resources on all the COVID related efforts on HUD.gov.
My question I was thinking about when Chad was speaking, one of the groups that HAC works with, and they're a multi-service community action agency. They're a Head Start provider. So at the beginning of the pandemic, this group kind of shifted gears and provided childcare services to frontline essential workers. Have you guys seen any best practices or models of people who have pivoted and done innovative things underneath the current environment since March? Anything you'd like, any stories or anything inspirational you'd like to share?
So we have had a couple of tribal organizations, tribal colleges that have started and requested some funds from community facilities to revamp facilities so that they could provide childcare as a part of the services they provide at the college. That they were not previously providing childcare services, but they wanted to have those services available to assist the people that were having to come into the facilities.
Anybody else? Anything cool, fun, innovative? Best practices? Okay. Well, I'm going to move on to the final question then, because we don't have anything else coming in from the audience. As we close the discussion, are there any key program shifts that you either are in the works or you're anticipating, or any changes you'd like to highlight at your agencies that could have a major impact on funding accessibility, program implementation, kind of heading into 2021, or anything else you want to highlight?
Well, I can start. From the HUD percent, I mean, obviously the big thing we want to be on the lookout for is what Congress is going to do over the next few weeks. That's going to have a huge effect on how all of our programs have to operate and respond. Congress is debating several different strategies. So it could be that there's more funding for each of our agencies that we'll have to be deploying. So that's sort of a wait and see. I think that my main point earlier was what Congress does on unemployment insurance is going to make a big difference on how all of our programs are running. So we're talking right now about the rental assistance programs haven't been really hit hard in terms of recertifications and having to be, and that's largely because tenants who lost their jobs were getting unemployment benefits. But if those go away, we are going to see those programs needing more money. And that's something we'll have to adjust to. And of course, more people who are going to be needing food pantry services, needing rental assistance, those kinds of things, that could all ramp up in the next few weeks. So I think the next few weeks are really, really critical in terms of how all of our programs are going to respond.
And Stephanie, I'll jump in here too on that. For our single family program, I don't see any major policy shift, but we are, we're just trying to determine what flexibilities we're going to have to use to be able to continue to assist folks based on some of the stats that Todd has. Some of the unemployment people have been on forbearances. Credit may be an issue. So for us, it's going to be more looking at those underwriting flexibilities over the next 12 months to not, for lack of a better term, penalize people for being impacted by COVID.
Steve, Jen, Todd, any final?
Well, not on the policy side, but I really want to encourage folks as they experience these new things that come up to reach out. I did also hear Chad and the other folks from USDA also state that the importance of communication. I want to again emphasize that we need to know what you're experiencing. I don't know of any policy issues. That's more of Todd's area overall, and he did a great job of explaining that. I agree. CARES Act funding is available, or even to some of our rural communities, and they need to take advantage of them, probably even more so. But just make sure you reach out to us and let us know what's going on, because that way we can determine how we can help you. And I would say that the folks at USDA have also emphasized that communication as well, as we at HUD, Todd and I have.
Anyone else? I did get one more question in. I think it's for Cathy. Okay. Final question, then we'll wrap up and move on. How has the widespread use of appraisal waivers affected rural home valuations where AVMs are less reliable?
I haven't seen any necessarily impact in valuation. The impact really has been getting appraisals timely. We've seen a lot of, especially in the more remote rural areas, being able to get those appraisals in timely to help folks, meet their closing deadline. We've seen more of a challenge there, not necessarily valuation values. Our average loan amount on both of our programs, direct and the guaranteed program, are increasing. So I'm definitely not seeing any decline in value out there.
Thank you. On behalf of HAC, I want to thank everybody for participating today. I personally found this session very helpful and very informative, and I think this was a wonderful session, and I'm going to turn it back over to our little interim sessions, and we'll be back in a few minutes with 2020 Vision Pathways and Outcomes. Thank you so much, everybody.